Okay, so a very quick video on strategies that you can use if you're working from home, or you are obviously, as most of us are, we're kind of we're stuck at home for the foreseeable future. So three main points really. First one is breathing. Okay, obviously everyone knows how to breathe, and it's very simple to breathe. However, when we it's a very stressful time at the moment, and when we get a little bit more stressed, we could have the potential to increase our breathing rate a little bit, which can also decrease your attention on the task at hand. So say you're doing some work for your job from home, and things are getting on top of us a little bit, we might be thinking about 15 different things at a time and losing our focus on what we're trying to do. So a very simple way in which we can potentially focus on the task at hand is to just slow our breathing rate down a little bit. So what we would do with that is we would have our lips together, teeth apart, tongue at the roof of the mouth, and just really slowly breathe in and out through our nose. Secondly, I would be looking at adding in some little movement snacks through the day. I took that from a guy called Ben Cormack, who's one of my old mentors. But effectively what we can do are things such as, so we're going to get quite stiff in around our necks, in around our torso, in around our lower backs, particularly if we sat down a lot. So what we might do, it's a focus on slow, relaxed movements. So we might just do things like very simple little head circles. Okay. I might do things such as little side flexions. Okay. And then I might even I might keep my head pointing forwards and then move my lower body, which is again going to cause a little bit of nice relaxed rotation through my neck. If I want to mobilise in around my rib cage, I might just get up and do some almost like sort of body popping type moves where I kind of take my chest in and push it away. Okay. I might do some just basic little slow side flexions, and then also some little rotations. Okay. Trying to make sure that imagine I've got a laser beam coming out of my chest bone, and I want to spray it across the whole room so that I'm not just moving through my hips, I'm actually moving through my chest. Okay, very simple. Then I might want to move on to my lower back, and I might want to do things some nice gentle anterior posterior pelvic tilts, little hip circles, which looks a little bit funky. Okay, in different directions. Might do some little hip hitches where I'm just hitching my, and I really struggle on my left side because I have a little bit of a history of lower back dysfunction on my left side. And then the third thing is to effectively just obviously make sure that you are, well, it should be 4 things really. Obviously keeping in touch with people, use technology, chat to friends, family, try to keep in contact with your normal social circle as much as possible, and then going for a daily walk and a daily run. For caveat to the run, and just don't go for a run every single day. If you go for a run every single day and you're not used to that, even if you are used to that, to be honest, most of the time you're going to break down at some point. Try to allow for a day, especially if you're a novice runner, try to allow for a day's rest in between your runs. Potentially start off on a run walk, do your couch to 5k type thing. But just make sure that you're withstanding the temptation to go out and do too much too soon just because you want to let off some steam, because ultimately that's going to come and bite you in the bum most probably 4 weeks down the line. Cumulative load injuries tend to have that effect. They don't tend to make you sore during that 1 week too much. It'll be in 4 weeks time that you'll start to notice that your knee's sore or your Achilles is sore or something like that. So yeah, go for focusing on your breathing,